Vaginitis is a very common chief complaint for women. We do have a normal vaginal flora, very diverse. We have gram-positives. The most important one is lactobacillus. We do have gram-negatives. One of the most important is Escherichia coli. We also have anaerobic gram-positive cocci, like Peptostreptococcus and Clostridium species. Also anaerobic gram-positive bacilles, like Lactobacillus species. Other types, Actomyces israeli. Also gram-negative anaerobic species like Bacteroides, Prevotella, Fusobacterium. And we do have Candida albicans, that's a fungus, also as the normal vaginal flora. Normal vaginal flora is important to maintain the pH, and the equilibrium should be maintained. If this equilibrium gets into disbalance, dysfunction will occur. So, essential diagnosis for candidiasis, which is one of the most important vaginitis caused by Candida albicans, will produce intense vulvar pruritus, white vaginal discharge, which is very typical, sometimes vulvar erythema. If we do a KOH preparation, which is main gold standard thing that we can do usually for fungus, we're going to see some filaments or some spores that will make the direct diagnosis. The gold standard is going to be a culture. But let's go into the epidemiology. Candidiasis will occur in 75% of women during their life. All women will have a candidiasis in their lifetime. Pathogenesis has to do with the etiology. Candida albicans is one of the most common Candida species that will cause symptomatic vulvovaginitis in 90% of them. Remember that Candida albicans is also part of the normal flora in the mouth and the throat and the large intestine and also in the vagina. We need candidas in those locations. But when, for any reason, Candida raise up the number of fungus, especially in the vagina, that's what we're talking about, we're going to see clinical symptoms of the infection. So there are special considerations where Candida loves to live in women that have special medical conditions like not well controlled diabetes, mellitus, HIV, and obesity. Also pregnant women or women that are under or has been under antibiotics, corticosteroid, or oral contraceptives. Any other medical condition that will produce problems with nutrition also can cause candidiasis. So, immunocompromised patients also can present candidiasis. Bacterial vaginosis is another type of vaginitis. It's characterized by vaginal discharge, but in this case, it's going to have a special odor, fishy odor, because because of that odor, we can do a test, that is the whiff test, and we're going to make sure that with potassium hydroxide solution, if we add it to the vaginal secretion, we are going to be smelling that specific odor We also can do a microscopy exam and see epithelial cells. We can also measure the vaginal pH. It's going to be over 4.5. And what happens in bacterial vaginosis is that we have a decrease in the normal flora, specifically in the lactobacillus. And part of the pathogenesis has to do with the etiology. Bacterial vaginosis is caused mainly by Gardnerella vaginalis, but also it can be caused by other species of Prevotella, Mycoplasma hominis, or Mobiluncus species. It is in pregnant women, bacterial vaginosis is one of the cause of preterm labor. So it's important to diagnose early and treat it. If a woman has bacterial vaginosis, has an increase of pelvic inflammatory disease, and it's also going to have an increase of risk of sexual transmitted infections. And if the patient is pregnant, it's going to have a high risk for preterm birth or preterm labor. Aerobic vaginitis pathogenesis has to do with the etiology. It's a disruption of the normal flora. Specifically, the most abundant one is lactobacillus. So the difference between aerobic vaginitis and bacterial vaginitis is that aerobic vaginitis is characterized to have a more extreme inflammatory changes in the vagina, and also the pathogens are a little bit different. So the most important one is Streptococcus agalactiae, which belongs to the group B of Streptococcus. But also we can find Enterococcus faecalis and Escherichia coli and even Staphylococcus aureus. Aerobic vaginitis can be seen in pregnant women, and it can cause preterm birth. It has been reported as one of the most some complicated vaginitis because of the extreme inflammation that can cause a lot of symptoms. We can see in the vaginal discharge, if we see it under the microscope, we're going to see leukocytes, white cells. And also in the examen, we're going to be seeing a thinner vaginal mucosa. And also in the vaginal smear, an increase of number of intermediate and parabasal cells. With bacterial vaginosis, we only see epidermal cells. In this case, it's like a little bit under than the epidermal tissue. This indicates an increase of the turnover of desquamation of the superficial epithelial cells, of the superficial layer cells. So let's make a differentiation between bacterial vaginosis and aerobic vaginitis. The pH for bacterial vaginosis, as I told you, is more than 4.5, which is more towards the alkalosis. In the case, it's over or equal to 4.15 in bacterial vaginosis. In aerobic vaginitis, it's going to be between 4.5, usually around 6, more alkalotic. The discharge for bacterial vaginosis is going to be white. For aerobic vaginitis, it's going to be yellow. these are generalizations, okay? So do not take it. I mean, we can see, when we see patients have a little bit different things. In the case of bacterial vaginosis, it's going to smell fishy, odor with a positive with test. On both infections, we're going to have lactobacillus species displaced. If I see the epithelial inflammation is going to be more present in aerobic vaginitis. The etiology for aerobic vaginitis is going to be group B streptococcus, Enterococcus faecalis, Escherichia coli, or Staphylococcus. In the streptococcus group B, Streptococcus agalactiae, remember. In the case of bacterial vaginosis, it's going to be Gardnerella vaginalis, mainly. And the treatment is going to be very different. So for bacterial vaginosis, usually we use antibiotics type clindamycin or anti-parasites medications like metronidazole. In the case of our aerobic, we're going to use kanamycin, fluoroquinolones like ciprofloxacin, and also clindamycin can be used topical. So, essential diagnosis for trichomoniasis. This is a sexual transmitted disease. It's not a bacteria, it's a parasite. We're going to see discharge that could be full smelling, greenish, profuse. pH of the vagina also is alkaline, exceeds 5.0. Vaginal can be erythema with petticoats and very strawberry spots in the vagina, also in the cervix, by the way. We can do wet smear, and we're going to see a very multiflagellate organism, as you see here in the pictures. Trichomonas vaginale pathology has to do with lower urinary tract. It can cause some different symptoms depending on the gender. So it's a sexual transmitted disease. Non-sexual transmission is very infrequent. So this is a non-bacterial, non-viral. This is a parasite that will cause symptoms in men and also in women. It's called trichomoniasis. We're going to be seeing urethritis, basically in the man, and cervicitis, basically mainly in the woman. But women also can experience dysuria, itching, burning, redness, soreness of that genitalia, vaginal discharge. And in the cervix, we can see like a strawberry petechia type of thing. This infection is having trichomoniasis will predispose and increase the risk of transmitting other sexual transmitted disease, including HIV, and also complicates pregnancy with preterm birth or preterm labor.